Alsobrooks.
Thank you so much, Chair Cassidy, for hosting today's hearing. Dr. Means, welcome. Thank you so much for being at this hearing, and congratulations again on your beautiful, beautiful baby. I want to first begin by the places where we agree. The industry, you agree that industry should not have undue influence over our health policies. In fact, you have written that when pharmaceutical companies have a direct line to network television through advertising, and I quote, you say they can have influence over what messages are emphasized on the news and what is deemed misinformation or truth. Now, can you confirm that those are your words?
That sounds like something I would say.
I'm sorry?
That sounds like something I would say.
Okay, perfect. And I also want to confirm again that you have been compensated. Have you ever been compensated for platforming, spotlighting, or highlighting companies in your newsletters or podcast appearances?
Yes.
Okay, so
Or
for
not
example,
podcast, but in my newsletter, I've had newsletter sponsors for my newsletter, yes.
okay, for example, Energy Bits. Have you received compensation from a company called Energy Bits?
Yes.
Okay, and in your newsletter, the very same one where you rail out against pharmaceutical advertising, you acknowledge that Energy Bits sponsored your newsletters. And I wonder, were you aware that the Better Business Bureau found that that company, Energy Bits, failed to provide substantiation for health-related and environmental claims and recommended that it discontinue doing so?
Senator Alsobrooks, I take conflicts very seriously. I've worked diligently with the Office of Government Ethics to make sure we've looked at all potential conflicts of interest, have signed a letter, had been cleared, and have signed a letter stating my commitment to divestments. And of course, during my time, if I am confirmed in office, I would take no money from any company.
Let me, Dr. Means, let me just add a little bit more here. I know the time is tolling. Were you aware that this same company was served notice under California's Proposition 65 law alleging that their products contain lead above the allowable levels? Were you aware of that?
Again, I just want to reiterate, in this office, I will not be taking any financial compensation from any companies. I will be complying with the Office of Government Ethics thoroughly before, during, and after my time in office, and I'm very committed to that.
Okay, let me ask you about another company. Have you ever received compensation from a company called Peak?
Yes.
Okay, and in your newsletter number 33, you acknowledge that Peak has sponsored you. Now, were you aware that this company was served notice under California's Proposition 65 for containing and failing to disclose that lead above the allowable amounts, a carcinogen and reproductive toxin, was present?
I just want to repeat, I've worked with the Office of Government Ethics. I am not going to be taking any
Okay,
financial
but we're talking about just the
compensation.
ones you've already, so this is an
We're talking
ethics.
about conflicts.
Mhm.
And I have been cleared by the Office of Government Ethics through an exhaustive process. I have signed a letter that I will be fully compliant. And this is before, during, and after the term. I take it very seriously, and I'll work closely with them to make sure there are no conflicts.
The point here is that you've received compensation from these companies, including Daily Harvest, where this company was subject to an investigation by the Food and Drug Administration after hundreds became seriously ill after consuming the product. And these are companies that you have received money from. They've been investigated, and you are railing out against pharmaceutical companies that you say are advertising these products that mislead the public, and yet you've received compensation from companies, and you've promoted them in your newsletter, and you're doing the same thing the pharmaceutical companies are doing by advertising and influencing people for these products that have been deemed to be unsafe for the public. Now, let me just move on as well to vaccinations. I want to just, you tweeted that you believe the hepatitis B vaccine at birth is a crime. That is what you tweeted. Do you recall tweeting that?
That is not the full tweet.
I actually do have the tweet. I can provide it for you. I have a copy of it here where you say that vaccinating, that you believe the hepatitis B vaccine is a crime. And I wonder if you believe that, how is it that vaccinating children against hepatitis could be a crime?
I support vaccines. I believe vaccines save lives. I believe they're a key part of our public health strategy. I also believe that this administration is committing to making sure we have the safest vaccine schedule in the world, and that we are continually studying the vaccine schedule, vaccine injuries, making sure we're eradicating conflicts of interest in vaccine research and doing gold standard science on vaccines. These are all things that I support. And I think there's a nuanced conversation that American families are looking to have about shared clinical decision-making with their doctors about specific vaccines that their children may not be as seriously at risk for. And I think that, that is the nature and the thrust of my comments.
Well, let me just follow. I know my time has expired. You have spoke on this panel about neurotoxin metals and vaccinations, yet you have promoted through a brief research. Okay, just this last sentence here. You've through a brief search of the products that you've made money off of in your newsletters, many of them have been found to contain the same neurotoxins that you claim are in these vaccinations. I yield. Thank you.